Good morning, magandang umaga po. How are you doing today? We're going to talk about the most discussed item amongst people who are retiring or traveling overseas for an extended period of time, in particular the Philippines. And that is medical care, medical insurance. Those are the two things that are most discussed. But we're not going to talk about medical care. We'll only talk about medical insurance. It took me 2 years, believe it or not, 2 years, 2 long years to fully understand what this is all about. Of course, that is not 2 continuous years, but it's off and on research and interviewing different agents. This is what I want to share with you today. Everyone says, and I know what Medicare will not pay, that I know that Medicare is not going to pay for anything outside of the US. Once you step out of the US, Medicare is out. Well, it is strictly a US insurance program, they say. But let me show you how my policy with Humana includes coverage in the Philippines or overseas, any place whatsoever. I have an Advantage plan that has worldwide coverage, and this is a living proof. Let me show you. This is my policy with Humana Gold Plus. This is an Advantage plan. Let's look at 2018 coverage. It says worldwide coverage. For each emergency room visit, you pay $80 copayment, but if it's waived, it's waived if you're admitted within 24 hours. Now, if you are interested in learning what to do to get this, hang loose and stay with me. Get a cup of coffee, and I'll show you the ins and outs of Medicare insurance. In this episode, we will be talking about the following: Medicare, also known as Original Medicare, Supplemental Plan, and Advantage Plan. Oh, we'll also touch on Prescription Drug Plan. We'll touch on this briefly, as this is not a significant piece of medical insurance, although important. Why is that? It's important because most people have at least one and many times multiple prescription drugs that they take. In my case, for example, I take eight prescription drugs every single day, and I think 2 at night. Okay, so in those terms, I'm not waiting in case I get sick, in case I get cancer, in case this. Every day, that's guaranteed I'm taking it, and that is the reason why it is important. I will present this explanation in PowerPoint to make it easier for you to understand. The first thing that we will cover is Medicare. It's also called the Original Medicare. When you reach the age of 65, let's say, you will get your Medicare. It is mandatory, and it's paid for by the government. But that is only on Part A. Part A meaning it covers the hospital. As I said, it's paid for by the government, and it's mandatory. It covers 80% of your hospitalization cost. Well, but what will you do with the doctor's fees? That's also called the Part B, doctors, but that's paid for by you, the insured, okay? You will pay for that. It's strictly optional. So if you're overseas and you don't need it, terminate this, okay? And you will save yourself some money. This also covers 80%. Okay, and for Part B, you will usually pay about 140, again, it's 142, 145, thereabouts. And sometimes it could be more depending on your income. If you're still making a lot of money, your contribution here could be greater than 140. But most people, when they retire, they no longer have income from other sources other than their Social Security and pension, maybe. So usually they only pay $140. But who will want to be insured for 80%? So if you have a $10,000 bill, and that is not unusual in the United States, as you know, you still have $2,000 to pay because they'll only pay $8,000. So what do? They could either get a supplemental policy, which is paid for by you, the insured. This is optional. If you want to pay the 20% after Medicare pays for the 80%, it's up to you. But nobody wants to do that. So this will cover the 20% that is not covered by Medicare. And also certain exclusions and deductibles, they will all cover this, okay? And this will cost you about $200. So altogether, it may be costing you $340, although when I talk to a lot of people, they say, oh, I only paid $200. And again, this $200 is just an estimate, okay? They don't realize that they're paying $140, which is also being deducted from your Social Security check. So you're paying for it, for the $140. If you did not have Plan B, you will have $140 more of Social Security check. So that gets deducted, and this is all they're paying, that they believe, what they perceive as their payment. It's actually $340. Okay? So you're looking at, because this could go up depending on the kind of plan that you get, to higher amount. This could be higher amount also depending on your income. So let me see, this is total of $340, and I just say to give it a range anywhere from $300 to $350 you'll pay, maybe even $400, okay? Now, when you have supplemental, you don't deal with Social Security at all. You just deal with supplemental. I'm going to use my insurance company, Humana, in this case. In this case, if I have supplemental with Humana, I will only deal with Humana, and Humana will take care of everything, well, with the exception of some exclusions and deductibles. They also have deductibles and exclusion, but not as bad as if you only have Medicare, what they call original Medicare, okay? So with the exception of those small amounts, they will take care of settling the 80%, meaning Medicare will pay 80, they will absorb the other 20, but you don't see it because they're dealing with Medicare, but Medicare is still involved. Medicare will still pay for 80%, and they will absorb whatever is not covered, with the exception of few deductibles. And that is the reason why this is called Medigap insurance. They're paying for that gap, that difference, that 20% and some other deductions and whatever. They will cover that, okay? So for about $300 to $350, let's call it $340, you will get yourself a supplemental which covers you extensively. By the way, this does not include prescription drugs too. When you buy your supplemental from, let's say, Humana, okay, it does not include prescription drugs, so you will have to, that's optional, you will have to pay that yourself, and that could cost you another $10 to $20. And when you buy that, let's say, when you go to Humana, for example, they will give you an option as to what drug coverages you want. And there are different plans depending on what drugs you take. Some drugs are very good on some disease, some drugs are not so good on others, and you will have to look at a plan that sort of fits your situation. And many times they have a computerized thing. You put all the drugs that you're taking now, and they'll give you the best plan to buy. Okay? Now that total, for just estimation purposes, if you add 310, that's 310, and then 350 and 20, 310 to 370. Okay? So that's what they're estimating. Now, this is one whole insurance by itself. Let's talk about the other option that you have, and that's called Advantage Plan. They call it Part C in Medicare. When you choose Advantage Plan, Medicare is completely out, okay? Because Medicare Advantage, Medicare will pay, the original Medicare will pay the Advantage Plan company, in this case, let's say Humana, okay? Say, and I'm not sure exactly how much they get paid. I guess it depends on what they're negotiating and the time of the year, etc., etc. But let's say they pay $1,200 a month. So we'll assume that as the total payment to Advantage Plan Humana. okay, for the total responsibility of insurance. Meaning, if you get a bill for $100,000, Medicare will not pay for that. It's this Advantage plan, Humana in this case, who will pay for the whole thing. Over here on the supplemental, Medicare will still pay the 80% and then they will absorb the 20%. Do you see the big difference here? Now, the only condition, and by the way, this is a condition by Medicare also, whether it's supplemental or Advantage, they have to provide you with the minimum that is covered by Medicare. So if Medicare says you're not covered for cancer treatment, you're not covered for this, they don't have to give you that, but they could offer you that. Okay? So, but if they say, oh, you'll be covered for, let's say, psychological testing or whatever, then they will be, whether it's supplemental or Advantage, they will be required to cover you that. So, either supplemental or Advantage, they have to provide you with the same coverage that the original Medicare provides. Okay? Plus, if you want, optionally on your part, you can offer more. And usually they do offer more to make it attractive. All right? So, with the Advantage plan, now look at this. It will cover 100%, also subject to copays, deductibles, and exclusions. And they will also include prescription drugs, which over here you will buy separately. Okay, if you get a supplemental, you have to buy that separately. Usually, they also include prescription drugs, dental, and or eyeglasses. Okay, now the advantage, the disadvantage over the Advantage plan is that they usually have higher copays, more deductibles, and higher exclusion, certain exclusion. Okay? Compared to supplemental. Supplemental usually covers more, and you usually do not have copays, and so forth and so on. Well, guess what? I have been in this Advantage plan for 2 years. In 2 years, my wife only had one surgery. Okay? In 2 years, my wife had a surgery and I only paid $200. Maybe if I have supplemental, I would have not paid it $200. Maybe it will be covered 100%. So all I have to do is to go to the hospital, show them my insurance card, and the insurance company takes care of everything. Now, I'm not going to say that that is the case in all cases. For example, on certain cancer treatments and such, there may be a small deductible that you will have to pay, but definitely not as high as you would pay in the Advantage program. But if you're not sickly, you seldom go to hospitals, okay? Advantage is better. Why? Well, guess what? On Advantage, you still have to pay Medicare this $140. I don't know the value of this, but let's assume this is $800, okay? And now, so that's worth $800, and then you're paying $140, so that's $940. I don't know, maybe this is $1,200 or whatnot, but they're paying the entire amount to Advantage plan, so that they do not have to worry about this liability. If you have a $100,000 bill, it doesn't matter. That's their problem now. Humana Advantage. Okay? So, you have to pay this. Now, if you have the supplemental, you still have to pay the $140 because they are collecting the 80% here. If you don't have this, what are they going to do? So, one of the requirements is that you have A and B coverage. The Advantage plan also says you have to have A and B coverage. Because you need to have B, this one is no cost to you, but because you have B, you have to pay $140, and that is usually deducted from your Social Security check. Okay? So you don't even see that. Okay? So all you have to do is to pay this, which is anywhere from $0 to $120. So your cost here is anywhere from $140 if you have a zero plan, and $260 if you have a $120 a month Advantage plan. Guess what? In my case, I selected the zero plan, so I'm not paying anything to Humana. I only continue to pay $140 for Part B. So my total cost,
140. Okay? And guess what? That includes prescription drugs. I'm getting my 8 prescriptions with 0 deductible. When I go to my physician, I'm not talking about the specialist. It's my family doctor. 0 deductible. Okay, so that is pretty good. Now, this will not apply in all cases. You have to look at the individual plans because there's so many plans that are involved here. But guess why I got so attracted to this? Now, the disadvantage of this, okay, well, I'm getting ahead of myself. This supplemental plan, it says, may include international coverage, but only on emergency cases and valid only for 60 to 90 days from leaving the United States. It's like vacation travel insurance. After that, there is no coverage. The nice thing about the supplemental is, let's say you're only living in the United States, but you travel a lot like me. I'll go every once in a while. I go to Washington. Every once in a while, I go to Connecticut. What if I get sick in Washington? Well, this Advantage plan is like an HMO. You have to belong to a group within your locality. If you step outside, okay, of that group, you are responsible for cost. All right? With the exception of emergencies. Okay? That's the big difference between supplemental and Advantage. Supplemental, you can travel anywhere, you can choose any doctor, you can choose any hospital, and they will pay directly. So here, the big difference is this may include international coverage, but only limited to 60 or 90 days. Once you get sick, past the 90 days you left the U.S., tough luck. Okay? That is your problem. That will be your cost. Over here, it says it includes worldwide coverage, but only on emergency, and you must pay the provider, then seek reimbursement from the insurance company. Let me explain that further. For regular sickness, like I have a flu, you just went to see the doctor, you got a prescription, you went home, blah, blah, blah. That's not covered. You have to pay for that. But you know what? The medical cost in the Philippines, and I can't speak for other countries, but in the Philippines is so inexpensive, relatively speaking, okay, for the U.S. compared to the U.S., that sometimes the cost to pay the doctor is even lower than the co-pay or deductible that you will pay here in the U.S. All right? So that much I can say. Now, but if you get into an accident, you got hit by a car, or you had a heart attack or something, you need to be treated and it cannot wait, okay? Then it will be covered by Advantage. But here is the big but here, okay? In addition to the fact that it has to be an emergency situation, and by the way, I did talk to Humana directly, not the agent or not the salespeople, and they said just about everything you have to go to the emergency room for it to be covered, because you go to the emergency room, that means it's an emergency case. If you don't, you just waited and then you went to your office, you did an office visit to your family doctor, that is not an emergency. They will not cover that. So you always have to go to an emergency room. Now, and here is the other big thing. They will not, okay, the Advantage plan or insurance will not pay the service provider directly. What that means is you have to have the money to pay for it. You have to pay cash to pay for it, especially in the Philippines, okay? And then you get all the paperwork, the doctor's diagnosis, the prescriptions, blah, 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 the hospital bills that you paid, and then you send it to the U.S., then they will reimburse you. This is going to be a decision tree. The next question you'll ask me is, well, what do you think is best for me? So you just go through this and hopefully I covered everything, okay? So if you're healthy and you don't care about insurance, then ignore this whole chart and move on with your life, all right? Because you don't care, okay? Now, if you're in the U.S. and not traveling, you're just a homebody, but you are sickly or has a medical condition of some sort. Let's say, well, if you have high blood pressure, everybody has some sort of high blood pressure. But if you really have a serious situation and you're likely to have a heart attack, get a supplemental plan. because it gives you more coverage. You can go to your doctor anytime. You can go to your doctor 100 times a week if you want. Okay? It will be covered. There is no limit. Okay? Now, if you are healthy and you practically don't visit your doctor except for routine, maybe once a year or once every 2 years, in my case, I mean, twice a year, not once every 2 years, but twice a year, you're healthy, no medical condition. Consider getting an Advantage plan. And here I have a footnote. Watch for the next slide. For the limitations of Advantage plan assumes worldwide coverage is included, because not all Advantage plan, I just found this out, have worldwide coverage. Okay? You're in the US, but you are a domestic, frequent domestic traveler. Okay, you just like me. I go to Washington, I go to Connecticut to visit my children. If I get sick and I have an Advantage plan, I don't know what I will do. Maybe I'll pay the 20%. So in this case, get a supplemental plan. Less headache for you because you're traveling frequently to the US, within the US. Now, you're in the US and only travel less than 90 days overseas. So you're a homebody, except once in a while you want to go on vacation, 1 week here, 2 weeks there, 3 weeks there, but definitely less than 90 days. And in some cases, if your plan is 60 days, then that'll be 60 days and not 90 days, okay? Follow 1 and 2 above. So it will depend on whether you're sickly or not. Then that will be your choice. And if you are sickly and you got the supplemental plan, you have to verify overseas coverage again, okay, even if it's a supplemental plan. Then you just buy travel insurance in those cases where you're traveling for 1 month, 2 months, 3 months. If you're only traveling for 1 week, hopefully you don't get sick. You take the gamble and don't buy any travel insurance. That's strictly optional on your part. But you have to take care of your daily needs in the United States. Now, if you're staying overseas greater than 90 days, or if you're semi-retired, you may want to retire in the Philippines instead and once in a while visit the United States. Okay? And you are healthy, get an Advantage plan. Because if you get a supplemental, you're only covered up to 90 days. Beyond 90 days, you're out of luck. When you come back to the US, you have supplemental, no problem. That's good for you. But the thing is, if most of the time you will be in the Philippines or overseas for that matter, okay, get an Advantage plan with worldwide coverage, okay? So you have to make sure that the Advantage plan that you get has worldwide coverage, all right? The reason I say this is this. I was under the impression, first of all, that Advantage plans are available in all states or all localities. Well, I know for a fact not all companies. For example, when I went to Washington, when I first discovered this, I went to Washington and I was walking at the mall and there was a stall or like a concierge who's selling United Healthcare policy. And I asked them about this worldwide coverage and they said, oh yeah, we have worldwide coverage. So that's how I learned that it has coverage. So when I went back to Pennsylvania, I was also looking, I called an agent, and he said, I'm sorry, but there is no United Health Advantage plan in Pennsylvania, or at least in your locality. I can't remember if it's the whole state. Oh, so what do you have here? We have Humana. Okay, fine, so let's talk about Humana. So that's how I found out that Advantage plan is not always available. Then my viewers in, I think, Los Angeles, California, interviewed Humana, and Humana said to them, no, we do not have one we have an Advantage, but we do not have one with worldwide coverage. So I'm telling you this just so you get to ask the right questions when the time comes. I cannot tell you what is available in your area, okay? So now if you are sickly, I would say just stay in the US. Do not gamble on going overseas because that's too much risk for you if you are sickly. You will be more secured in the United States. And then simply buy travel insurance if you are in the US. I mean, if you are overseas. Okay? So just stay in the U.S. and follow number 1, again, because you're sickly, and get supplemental plan in the U.S. Okay? Now, staying full-time overseas, you don't have any plans of coming back to the United States. So you don't really need insurance in the United States. So get your medical insurance policy overseas. And I don't know a whole lot, except I surveyed a few, and it looks like for the amount of coverage they're giving you, let's say for $10,000 or $20,000 a year, you pay so much money. If I make that comparable to the U.S., U.S. is cheaper because they give you like $1 million coverage or something like that. So it turns out to be too expensive relative to the amount of exposure that they're getting, especially with the low cost of medical care in the Philippines. Now let's talk about the third one. This is the very important one, okay? Limitations of Advantage Plan. It's not available in all states and all locations, as I explained before. You will have to search for one with worldwide coverage. Now, worldwide coverage will only cover you for emergencies. Non-emergency treatment is on your own, as I explained that before. Policy usually say that 80% of approved costs will be paid. Okay, now this is the one I said we'll discuss this later. The problem is I don't know what the approved cost is. Another viewer said to me that I think he had Humana and they paid 100% of his cost. So he was so happy. He was expecting that he will only get paid 80%. So I'm assuming, again, this is the key word here, I'm assuming that this 80% of approved cost means that is the maximum that they will pay. Okay, the approved amount, not the actual cost. For example, if you underwent a procedure that has an approved amount of $1,000, let's say the same surgery that my wife went through, let's say, if the approved amount is $1,000 and the insurance will pay 80%, that means they will only pay $800. But since the medical cost is generally less expensive in the Philippines, let's say if you paid $600, then the entire amount will be reimbursed. Now, this is just an assumption on my part based on what the viewer mentioned, that he got paid 100% of the cost. That means the 80% is applied to an approved amount for reimbursement, not 80% of the actual cost that you incurred. Okay? Now, this is a big one. Up to here, so far so good. But you must have cash or some resource for you to get the cash, because you will be required to pay the entire bill and then file a claim in the United States. What that means is if you get hospitalized, let's say in the Philippines, you get hospitalized and you have a $10,000, okay, let's avoid the conversion. Let's say that you already have $10,000, okay, and therefore let's say Humana will pay, even if Humana will pay 100% because of what I explained here, let's say that Humana is going to pay you the entire $10,000 that you pay the hospital. If you don't have the money, what are you going to do? Because they will not call the hospital and say, okay, we will take the responsibility for paying that. Okay, unlike the other insurance. And, you know, we're so used here in the United States where you have an insurance card, you just present your insurance card and you get checked in. Then when you check out, you pay the small amount of deductible, and then they settle up directly with the insurance company. Very nice, very nice. Okay, now if you have the Advantage Plan, especially in the Philippines, okay. Now, if you, by the way, if you have a local policy in the Philippines, you might be able to do it the same way as in the U.S. If that is the case, get a policy in the Philippines so that you don't have to have this upfront amount of money that you will need to have when you check in at the hospital. The only problem you have is when you go back to the United States, what policy do you have? Are you going to get a policy? Another choice you have is get the Advantage Plan with zero premium. Okay? Get the Advantage Plan with zero premium, but you still have to pay the $140 a month. But if you are planning not to come back to the U.S., that's a waste of money. 140, how much is that? 1,004, about $1,600. Okay, about $1,600 a year. So that's a lot of money. Now, Advantage plan has, compared to supplemental plan, higher deductibles and copays. However, there is usually a maximum out-of-pocket cost to protect you from catastrophic illnesses. However, such out-of-pocket cost is calendar year. So if you get hospitalized and your total bill is, let's say, $10,000, like in my case, I have a $6,000 out-of-pocket cost. So whenever I see a doctor and whenever I go into the hospital for minor this or that, but it's not really an emergency or whatnot, they get all added up together and they guarantee you will not exceed $5,000 cost. In my case, it's $6,000. So your total out-of-pocket cost for the calendar year. So if your maximum is $5,000 per year, that's per calendar year. You got hospitalized in December to January, and your total cost is $50,000. Okay, your maximum out-of-pocket cost will be $5,000 for December and another $5,000 for the following year, or $10,000. So when you check out, you will pay the $10,000, and the insurance company will pay the rest, not $5,000, because that's per year, and the cutoff is calendar year.
Well, there you have it. There are hundreds of plans available from different companies for different localities. I can't tell you specifically where to go and what you need to get. You have to do this yourself, but you have to persevere to get the right plan for you. I have just outlined the basic concepts so you know what to ask the insurance agent. And most agents, I repeat, most agents only cater mostly to Americans who are living in the US, and they have no interest or never had an opportunity to talk, discuss, or explain international coverage. So they only know one thing. Once you step out of the United States from day one, you have 90 days to get sick and be covered, or 60 days. Some are 60, some are 90. Beyond that, you're stuck. You have no insurance. Those who travel once in a while will simply get travel insurance. They also want to push the supplemental plan because they make the most money that way. And they will give you a scare tactic like, oh, what will happen if you have cancer, blah, blah, blah. Yes, there is risk in buying a less expensive plan, but that is the reason only you can evaluate if you should go for the more expensive plan or the less expensive plans. So, hope you enjoyed this video. Please do share this with others, as I'm sure more people are confused about this insurance fiasco that we have in the US. And if you have any comments, please put them down below. Please click like, and please do subscribe to my channel. Thank you so much, and make it a great day.